Greetings, New Zealand naturopath Eric Backer. I'm author of Candida Crusher and formulator of the Candida range of dietary supplements. Today we're going to talk about the inflammatory markers and comprehensive stool testing. So when you do a comprehensive stool test, there are many different areas that I'm interested in to look at when the report is completed. One panel is the culture of beneficial bacteria. We also can look at what we call the commensals, or bacteria that could be in transition from good to bad, and we can also look at the dysbiotic or the bad bacteria. We also look at parasites. We look at a whole lot of different things, which we're going to go over in other videos. One thing that we also look at are what we call inflammatory markers, and these are particularly important if you've got a chronic condition, particularly if we've got conditions like weakness, tiredness, maybe blood loss, diarrhea, watery stools. If you've been sick for a long time and they can't work out what's wrong with you, especially if you've got, anemia, you may have lost a bit of blood, or you could have had a blood test showing perhaps some signs of low ferritin counts or low iron counts. So you may have inflammatory bowel condition. You'd be surprised how many times I've actually diagnosed inflammatory bowel from a stool test, sent the patient off for a colonoscopy, and that's what we found. We found ulcerative colitis or Crohn's disease. That hasn't happened once, and it hasn't happened twice. It's happened many, many times over the past 20 years that I've actually done stool testing. So there's a couple of markers here we're going to talk about. I'll just read a little bit out of my book, Candida Crusher. Inflammation in the digestive system can significantly increase your chances of intestinal permeability, indicating an underlying leaky gut and compromising your ability to absorb nutrients. The extent of this inflammation, whether caused by bad bacteria or yeast or candida, or inflammatory bowel disease, IBD, can be assessed and monitored by examination of the levels of biomarkers such as lysozyme, lactoferrin, white blood cells, and mucus. These markers can be used to differentiate between inflammation associated with Crohn's disease or colitis, we call it inflammatory bowel disease, and less severe inflammation we call IBS or irritable bowel syndrome. So irritable bowel syndrome can be associated with yeasts and bacteria, but so can inflammatory bowel disease. But what differentiates one from the other, the inflammation from the more severe inflammation from the less severe inflammation, are these particular markers we're going to talk about now. So the two markers, one called lactoferrin and one called calprotectin, are basically products associated with white blood cells. So when we see an elevation in these markers, we know that there's more severe forms of inflammation going on. And the higher these markers are, the more severe the inflammation, and the more likelihood that I'm going to recommend you go for a colonoscopy to a gastroenterologist to distinguish, if you've got IBD or IBS. So lactoferrin, as it says, lactoferrin, it's got to do with iron, this particular kind of a marker. So it actually likes iron and will bind to iron, and lactoferrin is found a lot in breast milk. It's also found in, you'll find it in mucus, you'll find it in different secretions of the body and in the blood. But it's actually very important to stop viruses and bacteria from attacking our body. Antibacterial, antiviral, antiparasitic, anti-cancer, anti-allergenic. So it's a very important substance to have in the body. Colostrum, the mother's milk, contains 8 times more lactoferrin than standard milk. So it's very important to have this this marker in your body. And in fact, breast milk has a higher chance of reducing yeast infection because lactoferrin helps to count candida and is associated also with eradicating Helicobacter pylori infection and yeast infection from the body. This is why I really encourage breastfeeding for babies to stop bacterial and yeast infections. So very elevated markers in the stool can indicate a significant immune dysfunction that requires further examination. Calprotectin is a protein found in white blood cells called neutrophils, which make up 3/4 of our white blood cells. Some stool testing labs use calprotectin as their main anti-inflammatory marker, and some experts consider calprotectin to be the gold standard measurement of intestinal inflammation. The main diseases that cause an increased excretion of fecal calprotectin are Crohn's disease, ulcerative colitis, and bowel cancer. So levels of fecal calprotectin and lysozyme will be found to be normal in patients with IBS or irritable bowel syndrome. or just very slightly above normal. So it's important to get your inflammation checked if you've been sick for some time to determine, as I mentioned before, how severe the inflammation is. And then, maybe what further testing will be required. Lysozyme is different. It's an enzyme, and it's a protein enzyme. It's found in tears, saliva, and mucus. It's very, very interesting marker because if you've got a big elevation of this, it can often mean a bacterial infection. And it's something I often look for. And we often see elevated lysozyme in conjunction with low beneficial bacteria. So this is one of the best inflammatory markers for inflammatory bowel disease. Now you can imagine now if we've got all three of these markers elevated and we've got low beneficial bacteria and we've got candida, if we've got a significant elevation, I'd recommend you go straight off for colonoscopy. And in many cases, the diagnosis will come back as either borderline inflammatory bowel disease or you've got inflammatory bowel disease. So these are, again, reasons why I like doing stool testing. Be sure to do my Candida quiz at yeastinfection.org and subscribe to this channel. Thanks for tuning in.